Dr. Liana Sved is a doctor of physical therapy and myofunctional therapist with a decade of experience whose specialty is treating people with head and neck pain, TMJ disorder, and airway issues. She uses a combination of physical therapy and myofunctional therapy techniques to maximize patient outcomes. Her inpatient private practice is located in Stonington, Connecticut. Dr. Liana Sved also has a digital business which consists of TMD education, digital jaw pain relief programs, one-on-one coaching for people with TMD, as well as mentorship programs for healthcare professionals. Quick legal disclaimer: all information in this podcast is the opinion of the speakers and not meant to be a substitute for a diagnosis and consultation of a qualified healthcare provider. Today, I am so excited to have a rock star on my show, Dr. Liana Sved. And Leanna, welcome to Jaw Talk with Dr. Tiffany.
Thank you so much for having me. I feel honored to be on your podcast. So thank you so much.
Well, I was just saying before we started recording, I was really drawn to your Instagram. I started following you a few months ago, and I just love watching your journey and kind of your progression. So tell us a little bit about, what you're passionate about and your journey to TMD and physical therapy.
Yeah. So a little bit about me is obviously I do a little bit of TMD work here, right? That's what I'm passionate about. But how did I get to treating TMD, since it's not something that you see very commonly to treat, right? Well, I personally have TMD myself, or had TMD, however you want to kind of put it. I feel like it's a spectrum. And it wasn't, I would say it was probably like 4 or 5 years out of PT school. I was learning dry needling, learning cranio dry needling. So dry needling to the face, and didn't even realize it was a specialty I could go into. But the instructor, that's what she did. She was a craniofacial and orofacial pain specialist in the physical therapy field. And I was like, that is just so cool. And I want to do that. And that was the gateway. And now I'm much further down in through the gates than I don't know. I guess I've always thought that this is where I would be.
Yeah. Was that the American Academy of Manipulative Therapy, or who did you do your coursework through?
Yeah, my first round of coursework was through MyoPain, because I was living in Annapolis at the time, and that's where they're kind of based out of, is the Maryland area. I no longer really practice that technique, though. I find most people don't really tolerate it very well. So I've done more coursework in AAMT.
Yeah. Yeah. Because they're coming to Bellevue this summer, and I was this close to signing up for it. And my husband was like, babe, are you really going to go to a course in the middle of summer when this is our best weather in Seattle area? Okay, you're right. I'll wait. Yeah. So tell me a little bit. I know that your husband's an orthodontist, which that's a dream team. I feel like that's the perfect mix when you're talking about TMD and TMJ, because we know that it's not just the bite and how the teeth fit together. We also know that you've got to have healthy joints and you've got to have that healthy musculoskeletal system. Tell us a little bit about, how you guys work together.
Yeah, we really bounce a lot of different clients off of each other, right? So he may see somebody and he's very much has recognized that, not every scenario is a scenario where orthodontics is going to fix the pain, right? Because pain is multifaceted, right? It's not just the joint. It's not just your bite, right? Kind of what you're saying, there's so many different aspects to it. So we really need a collaborative approach when it kind of comes to this stuff, right? So he's recognized that. And so he really does support that collaborative approach. Education up front, hey, we can definitely change your bite. That's an aesthetics thing. But when it comes to your pain, it's kind of like a crapshoot. Is orthodontics going to fix it? Is orthodontics not going to fix it? And he's like, well, we have people who can help you work on the pain, work on the musculoskeletal system part of it, and he's pretty knowledgeable in the fact that our musculoskeletal system can change how our bite presents, right? So all of those things, he does take quite a bit of time educating his patients. And then vice versa. If somebody comes to me with, TMD, and you're noticing these bites that are got to be part of the issue, it's just nice to be able to then send them to somebody that I know has the same collaborative approach, whereas sending them to somebody who may not. So.
Right.
Yeah.
Well, and I think, like you were saying with pain, we know, I tell people, it's kind of like the layers of an onion. You could have some muscle pain, you could have like myofascial restrictions, you could have, nerve pain, you could have sympathetic nervous system issues. And all of those are maybe like complex regional pain syndrome. And all of those things are kind of contributing to the picture. So, I mean, I see a lot of adult patients in my practice that have kind of already been to like a lot of other providers, and then they're, frustrated. They feel dismissed by other providers, and they're like, I need answers.
Yeah. Yeah.
So,
Same here. Yeah. And I use the same analogy, layers of the onion.
yeah. But I think what's exciting for me and what I feel really passionate about is as we're, for me, I started getting into myofunctional therapy through the AMT like in 2016. And then I've also been kind of on a journey with another study club where I've learned a lot about just the joint itself and just being able to use like modern imaging and kind of put that together with my clinical exam. So like either like CBCT for like hard tissue and the skeleton, and then MRI of the joints, and like being able to kind of put that together, especially for our young female patients, kind of like that 10 to 12-year-old, because a lot of times what I'm seeing is like they may have gotten out of an expander and they may have like done some myo, but when you're talking about kind of that AP, the retrognathic mandible, the mandible's still not in the same place. And that's where all that modern imaging can come in and say like, okay, like, is your joint healthy enough for growth? Like if we do put you into that functional appliance, like a Herbst or whatever, will we get the kind of results that we're looking for? And so I love just like bringing in both airway and myo and TMJ. And I call it the triangle. But, especially with dentists, I think one of the things I was going to ask you is like, what do you think dentists get wrong about the TMJ?
Oh, oh my gosh. Like, what do I think they get wrong? One is that it's all about the bite.
Mm-hmm.
I think that they're always so focused on the bite this, the bite that. It has to be coming from a malocclusion. And they kind of just forget that there's other pieces to the puzzle, right?
Absolutely. Yeah.
Sometimes they even forget to look at the joints altogether. Like
Mm-hmm.
even in like the panoramic photos, like half the time, like
It's
the
off.
TMJs aren't even included in
Hello.
the panoramic photos. And I'm like, okay, great. And then also what you're saying is a lot of dentists still practice in 2D. Like
Mm-hmm.
there's so many resources out there to have a 3D image done of the joint, which is also very helpful. Like we have to look at it in 3D, not just in 2D to get
Yeah.
a good picture. Right. And just like also like what you're saying, like there's just so many layers of the onion.
Mm-hmm.
You have to be kind of looking at all these things, like what's the joint health look like what's airway look like, how are the muscles functioning. And so when dentists just tell me that it's all about the bite, I just
You want to scream.
like tear my hair out, not roll my eyes. I don't know.
For
Yeah.
sure, for sure. Yeah. Yeah. Well, and it's funny too, kind of with like my PT background, I understand, just kind of like osteopathically too, just with the arthrokinematics, like with like C1, C2, and like having atlas rotated and like what that does to like your head, the cant and of, the occlusal plane. And, so even getting a dentist to like, do any kind of like palpation of like SCM and like, these are all muscles that like, even temporalis, it's just like, oh, I don't want to touch the neck.
I know, I know. I remember when I first started doing this and I was like, I was telling my husband, I was like, do you even like palpate their muscles? And he's like, what do you mean? And I was like, like
Head
touch
and
them.
neck.
I was like, how about the neck? Like not just like the masseter, like other things like, medial pterygoid and like their
Yes.
SCM, their scalenes, like all these things that can be affecting, and like what you said, just like that, even that upper cervical connection.
Yeah. Yeah.
Yeah. Oh.
So like, what would you say your workflow is like when you are in the clinic, like seeing patients?
Yeah. So when I see patients in person, my workflow is like we do a lot of upfront, like just information gathering at every session, kind of like how do they feel after the last treatment, how treatment's going, any education pieces that we need to put in. Education is huge. I feel like the more they understand about what's going on with their body, the more their body can kind of relax and kind of enter that healing process because they have a better understanding, right? And then I do a lot of heavy manual in the clinic. So working on a lot of the anterior neck, so the front neck fascia, scalenes, SCM, suboccipital spine, even getting into that levator scap and upper trap, anything that kind of really connects to that, like you were saying, C1, C2 area, because that's a huge component potentially, especially if there's any sort of rotation or translation, right? Also, I do any sort of internal, external manual therapy to the muscles of mastication. So your masseter temporalis, your pterygoids, right? Dry,
There.
yeah. Dry needling if necessary. A lot of I honestly try and get most of my clients to do some dry needling. I feel like it is extremely beneficial to really get to some of those deeper layers of the muscles. I do look at like the tongue. We'll do some work to like the floor of the tongue stretching, that kind of stuff. If they're having trouble with or any pain that's kind of being elicited from that area. With some more like my more chronic, like I would say headache clients, I will do some craniosacral therapy more on the cranial side of it versus the sacral side. But it always usually seems to relieve pain. I know the literature can go either way, but if my patients feel better afterwards, then that's what I'm going to be doing.
Right. Well, and even just like putting your phone away and laying down in like a quiet room for like 30 minutes, that has to help your sympathetic nervous system, right?
Yeah, it does. And I love I'm not in my office right now, but I love my office because I was actually just having a conversation with a mental health therapist yesterday. But a lot of times people enter like a physical therapy office or a dentist office and you have the fluorescent lights and, these, beds or like it's a weird stench or whatever it is, right? And it's just very triggering because it's been a traumatic journey for a lot of these people, right? And my office is very bright. There's plants, there's natural light, there's no fluorescence. Like it's just a very different atmosphere. I don't play music. There's just ocean sounds or rain sounds depending on the day. So it's very peaceful.
And no like high speed drill like at the like operatory like but
No,
people are already like I don't want to have my teeth worked on. Yeah, for sure, for sure. So what do you love like if a dentist was like I want to send a patient, I want to refer a patient to you, what do you love when they write like the perfect RX? So because I just did like a study club where I was like, why the C-spine matters to the general dentist and how to write the perfect RX to your PT of like what you want.
that's a really interesting question because I don't think I've ever gotten like a great referral, like written referral. Like I get good referrals, I just don't get anything really written. But, any sort of detail that they're noticing honestly is helpful. Like doesn't need to be codes or anything like that, but just something beyond like
Evaluate and treat.
evaluate and treat. Exactly. My husband's really good at this. He usually gives me a synopsis or sends an email with a synopsis of what's going on. It may not have any diagnostic codes, but that's always really helpful. Just a little bit of a background before I call the patient to schedule them in. I've not even really thought about it because it's just that's what I've been getting handed. Evaluate and treat. Like, here's this person with jaw pain. I don't know what's going on. Usually, though, I do from endodontists are really good in my area. They're like they came in for dental pain. It's not nothing's wrong with the tooth. They tell me the teeth that's there, so that's helpful to know like muscle referred pain patterns, and that's helpful. So obviously muscle issues, that kind of thing. But yeah, it's very limited knowledge here. So
Yeah, yeah. No, it's crazy like how little like TMD just education we got in dental school. I remember like people were like, why do I have to know the nerve supply of like the serratus anterior? I'm going to work on teeth, or like the 2 days that we like rotated through, the oral medicine department. They're like, oh, this is so boring. Like she's just doing spray and stretch and like splint therapy.
yeah,
I
I
was
can
like,
resonate with that with physical therapy. I mean, we learned nothing.
yeah.
It was interesting. It was kind of like our two fields kind of played off of each other. It was like, oh, the dentist will take care of it. It's like, oh, the PTs will take care of it. Or not even that, you know what I mean? It was like there just was no acknowledgement of like what we can actually be doing.
Yeah. Well, and that's why I think it's just so crucial to like have your team that you can collaborate with, and it's so cool, I feel like with, everybody kind of going virtual, like all of a sudden you don't have quite the same barriers of like distance, you can hop on a Zoom call or do like a virtual visit with a patient, or you can have a study club that meets, where you have people from all over the world that are bringing kind of like their knowledge and their experience, and that is so exciting to me to see kind of that revolution.
Yeah, it is. It's really cool.
Yeah. No, I would say the PTs in my area, they are basically like, I've never seen a TMD patient that didn't also have like a neck component, and you think about the trigeminal cervical nucleus and kind of all those afferent things. And so in my practice, I'm not doing any restorative anymore, just I've limited it to TMD. And so I try to like loop in, some of my physical therapy experience, but also bring in some nerve blocks too, and just see, like if I do bilateral greater occipital nerve blocks, like does that, take care of kind of that like ram's horn pain, or, just I think sometimes even if you're just doing it with local anesthetic diagnostically, it's kind of like if you turn off this, does that make a difference to kind of the overall picture? And so, like greater auricular nerve blocks, of course, injecting into the joint, which is still like pretty scary too to me. But I think, like I said, I think what we have that's so exciting is just to combine like modern imaging with our clinical exam and our powers of observation. And I think dentists can be so, like precise with the, like you said, with the bite and with the teeth. So we just need to take that to that bigger lens, right? And then like start training them like, well, hey, like, they have this torticollis, like look at this SCM versus the other side. And, like they're already taking those clinical photographs, let's say for ortho, and you're like, wait, look at that forward head posture, or like, look at that retrognathic mandible. And like, just kind of getting that on the radar of like those red flags of like when you do see that anterior open bite, you should be thinking about what are some of the things that are causing that. Is it just a tongue thrust, or is there also like a joint component where the mandible's not growing the way that it should be? And so again, I think it's just exciting to see orthodontists that aren't afraid to kind of like bring in all of those things. And just, I think, especially in our young females that maybe already like hypermobile, or maybe they have connective tissue disorders, or maybe they have idiopathic, maybe they have like rheumatoid arthritis, or some of those things where you're starting to see the cross bites and the anterior open bites, and then you start to kind of like connect all of the things together. And so to me, like I want to be able to kind of have that crystal ball of like that young female, like 10 to 12-year-old who's like a gymnast and maybe like fallen off a rope swing, and go like, okay, is she going to be okay to go through ortho, or is this going to be like that patient that goes sideways, the deep end of the pool where they get stuck with a closed lock, or they have their wisdom teeth out and then they start have clicking and popping, and then they start having migraines, or so it just starts to become kind of like this cascade of events. So I just like, I want us to be able to like teach all of these other providers like our way of looking at things. And I think it's just going to make us stronger as professionals.
Definitely. Definitely. I think if we can just broaden our lens, it'll help so
Yeah.
many people.
Yeah. So I'm going to be devil's advocate. I've had one or two people in my study club say, well, I had this patient with a closed lock and I sent him to the PT and they got worse.
Yeah. More than likely that PT has limited knowledge of what's going on,
Yeah.
which is, like I said, like a lot of we can say there's across the board, any profession, PT, dentist, orthodontist, endodontist, oral surgeon, we have limited knowledge and training on TMD unless you've gone and pursued it extra, like, you and I have, right?
Mm.
So that is it. It's just that we are given limited training. So if you've sent somebody to PT and they've gotten worse, more than likely, and that PT just doesn't know what they're doing
They
for
need
that
they need a
particular.
rock star PT like you. Absolutely.
It's gotten to the point, like at least in my area, I don't take insurance. I'm cash based in all platforms, whether in person or virtual. And people will be like, oh, I don't want to go because she doesn't take insurance. And the providers that I do work with that are knowledgeable of that I've kind of educated on this, like, hey, not all PTs are created equal. Not everybody has TMD knowledge. Just like, I'm not the person to go see a back about, like, I'm not gonna get your back pain better. Just not going to, right?
Yeah.
And that's the thing, is like, you go to a specialist, right? You go to an orthodontist to do orthodontics. You go to cardiologist to get your heart looked at. You go to a urologist for any kidney and that kind of stuff, right? You don't go for this kind of stuff. You want to go to a PT, and I think that's the problem, is we're still seeing PTs as maybe like this over encompassing, like, hey, they're this generalized practitioner, which we are. That's what we graduate as, right? We graduate as a generalized practitioner, but we each, as we develop, have niches, right? We have specialties. And I think people kind of forget that. So like in our area, they'll be like, he's like, I don't know. You can go to another PT, but I can't guarantee you your results, because I don't know the knowledge they have on this particular
Absolutely.
topic, And like we've already kind of talked about on this podcast, is like, your training and my training is extensive. We do study clubs. We've done different types of, continuing education, dry needling. We've both done myofunctional therapy education. Like, there's so many different, like,
Pathways.
we've really widened our lens versus like, you go to Joe down the street for a closed block and they're gonna maybe only do masseter sweeps and, you know, maybe work on your traps. You know what I mean? So
Right. Yeah. Yeah, for sure. Like who in like the physical therapy world, who do you think is like killing it with like the education part for this particular area? Like are there
yeah,
any organizations that you feel like are really bringing everything together? Or do we
yeah.
just
Yeah, so
right?
the thing that I really think is, there are good intro courses. Like, so if you want to get better at like evaluating the jaw joint and getting better at evaluating like even the upper cervical spine, and maybe even some basic treatments, right? From like more of a physical therapy standpoint, there's a lot of great courses out there. Like, I personally always direct people to Mike Karaginis's course. He's based out of Wisconsin, but he has a bunch of courses everywhere. I think it's just, his course is short, it's concise, it's easy to follow, and he's one of my mentors. So I think I just like his course. Also taken, it's a more of an extensive course. I've taken Jeff Manhammer's course. He's based out of New Jersey. I don't know if he's still doing it, but I think he is. It's more of an extensive course. It's very detailed. My only criticism, I guess, on both of those courses is that there's really it's like very basic, right? And they're intro to TMD, intro to, TMD treatment. And they really don't dive into like a lot of the other muscular imbalances that can be happening in the jaw, exercises to be doing for them. It's more like both are need almost like an advanced tier, right? If
Mm-hmm.
that makes sense. Or even like, how do you collaborate or, educate, professionals in your area.
Mm-hmm.
So I think that's what's hard. That's like kind of what's missing, is that advanced treatment slash collaborative approach to it.
Yeah.
There's some really great courses
See,
out
and
there.
I feel like we need like these centers where you have like the sleep physician and you have like the ENT and you have the orthodontist and the PT and like, you have someone that I think the dentist should really be like kind of like directing how the treatment goes too, and not just being like, well, I'm just going to give you a night guard and like cross my fingers that, like that takes care of it, but then they come back and then they're like, oh, I was better for a while, but now I'm back to, where it was.
I mean, you can argue that for just about any profession, though. I mean, there's so many people who go to the ENT, they diagnose them with TMJ, and then like that's it. And it's like, okay, well, where to go from here? You know what I mean? or, they go to the oral surgeon or whoever it is, right? It's really like whomever their first point of entry is into the system, there needs to be more of a collaborative approach,
Yeah,
right?
absolutely.
Just acknowledging that there's more to it than just a mouth guard or
Yeah,
that's it, you know?
for sure. Well, and that's why I love like the myofunctional therapy community. It's just because I think we all come from such diverse backgrounds. You have people that are in the dental world, and then you have PTs and speech language pathologists and OTs. And I think, as PTs, we're more used to collaborating, especially if you have like a complex neurological patient. I mean, I did some of my rotations in that situation where like you needed the input of like your team to like, where are we going with this patient? So I love that community. And I think that we need to kind of bring that into the dental world, because dentists tend to be, very like siloed, like, okay, I'm just doing crowns and I'm just doing implants or whatever. And like you said, we've got to have that bigger lens. And, I think with Myo, I'm seeing dental hygienists like so excited. Like I spoke at a conference in November here in Seattle, and I was just like mobbed by a hygienist afterwards. They're like, we want to be like OMTs. Like, what should we do? Where should we go? And, so obviously there's like great organizations. Like, who did you do your OMT training with?
Yeah, AOMT.
Okay, same. Yeah.
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 And, I just gave a talk to a bunch of myofunctional therapists not that long ago. I gave a lecture to a
Was it
group that
on
was,
the coffee clatch?
no, it wasn't on Coffee Clatch. They're based out of, I don't know. I think the person who invited me was out of Boston. I have even no idea like what group I even talked to. I'll have to look it up and get back to you on that. But it was interesting because I really do think, we learn in AOMT that myofunctional therapy may not be great for people with TMD. Like, oh, we can assume that maybe it'll get a little bit better just based on the fact that it's an OMD, right? An oral facial myofunctional disorder, right? But there's a lot of people with TMD who do myofunctional therapy and nothing really like improves, or maybe their pain gets worse.
Mm-hmm.
But honestly, it's one of the things that I find has been my biggest asset in helping people with jaw pain, myofunctional therapy. But I think it's because, at least I would say in most of the courses, at least in AOMT, the grading is different. They don't really talk about adjusting the exercises and, for TMD. There's no TMD, like actual TMD education, and there's no adjusting or progressing the exercises from a pain level, which as a PT, we get training on. Like that's our bread and butter, is progressing exercises to relieve pain, right?
So tell us like what's next for you in your business. This sounds so exciting.
Yeah.
About one-on-one mentorship and educating other healthcare providers. Tell us what's happening with the jaw pain doc.
Oh, yeah. I mean, I guess there's a lot of things up the pipeline. So I will
Oh
be
no.
expanding, having like a new, well, not new, she's seasoned, but a physical therapist join my team, which will be wonderful because that just means helping more people, right? I do have a virtual side to my business, so we'll continue to expand that with some one on one jaw pain coaching. And then also trying to bring some education and mentorship to the arena. A lot of people want to learn more. What can they be doing more about, more for TMD? And whether that's, PTs, OTs, speech language pathologists, registered dental hygienists, or, whether it's dentists or other oral care professionals, but I definitely want to bring some higher level education from like a PT perspective on into the playing field in terms of coursework. Yeah,
Mhm.
that's in the pipelines for sure.
That's so exciting. Do you have to get some type of like certification in order to be able to offer continuing education credits for your PT license, or is that something that you're
Yeah.
pursuing?
As of right now, I don't know if it'll be something that'll be in that first initial batch of, people who do the coursework. It might be something that I entertain later. I think I have to present it to the APTA and that kind of stuff in order for it to be accepted, which is just a lot
It's
of,
a process. It's a lot.
especially since like, at least in my state, as long as I can pretty much take any coursework, as long as I can prove that is relevant to my particular position as a physical therapist. So
Oh,
yeah,
that's awesome.
so there's things that I can do, and it's a smaller state, so it's helpful. But yeah, so I don't know if I would like to at some point get it approved by the APTA for credits, or even other organizations for credit, and I think it would be helpful. I think a lot of people would be appreciative of that.
Yeah. Yeah. Well, for me, just to become like ADA certified, it's like a 7 to 10 month process. And like it's ended up getting like kind of pushed to the bottom of like the to-do list, like over and over again. But I love what you're doing with mentoring and virtual visits. I think people are just, they really want to like have that information and have that practitioner that can listen to their specific situation with and collaborate with other providers and have empathy. And you've kind of gone through that yourself with like your jaw pain, so I think that always brings like a personal experience. It kind of is comforting because you can say like, well, this is what it was like when I had this and this and this, and I tried this, and this is what worked for me. So I think that's
Yeah.
really helpful when you're talking to patients.
Yeah, it is. Especially like it just, even on the whole open lock, closed lock scenario, just knowing that you've been there with them. It's good.
Did you have that situation happen to you
Oh yeah, open locks,
where
yeah.
you open locks?
What?
Oh my goodness.
Open locks, yeah. Which I
That's
think are
scary.
that's scary. I feel like, closed locks are they're scary in their own way, but open locks are real scary.
Yeah. Yeah.
For
So
sure.
you've got some hypermobility. It sounds like if it's gotten stuck beyond the eminence there.
Yeah. Yep, I do. Regular, I would say. I mean, it's gotten better. I mean, obviously, I think a lot of body awareness and proprioception and that kind of
Mhm.
stuff, things obviously calm down, but you can still, if you're hypermobile, you can usually make any sort of pop reoccur.
Right. What's your favorite go-to exercise for yourself as far as like your TMJ? Like,
Oh, I mean, personally, anything that's going to reinforce midline. I have a
mhm,
pretty significant deflection. So, anything there's, for at least in the OMT world, waggle spot or tooth touch or things like that. Anything that kind of gives you an internal or external, what we call perturbation or movement, while trying to challenge the jaw to stay in midline.
mhm. That's
It's always a
awesome. Yeah,
good
love it. Love
exercise.
it.
Yeah.
Yeah. Well, for me, my dad was a dentist. And so, like, back in the day, I had headgear to like try to like shove my maxilla back to try to get my lower jaw to catch up. And then, like, in dental school, I had like 3 car accidents. And like the last one, like, my face hit my arm. It's like you're like 10 and 2 on the wheel. And I got sideswiped on the like freeway by Pasadena, like across like 7 lanes of traffic. And like I looked down and I had like lipstick on my arm, like right here. So like my face hit my arm.
Oh no.
And then the thing is, it's like I have seen like progressive bite shifting, and it's like I can control it with like conservative things. But when I finally got my MRI, it was like, yep, my disc is worse on the right side. It's everything's like shifting that way. It's like I'm cracking teeth on that side. And so, I think it's just really helpful to like know, kind of like your story and your anatomy, and then put it all together. So, well,
Yeah.
tell us where people can find you, and we'll link all that in the show notes, of course. But what's your main platform? Is it Instagram with?
Yeah, my main platform is Instagram. The_jaw pain doc is where you can find me. And then also the website is thejawpainjock.com. So pretty easy. But yeah, you can definitely follow me on Instagram. I feel like there's pretty good information and content on there. And I'm always open for more content. So, I invite you guys to ask any questions
Yeah, well, it has just been awesome talking to you today. I'm so excited for what you're doing. And like I said, I've been watching kind of like your progression of like your branding and, how you've been presenting yourself. And I just want to commend you for everything that you're doing because we need more people in the world like you, for sure. Before we wrap up, I want to express my sincere gratitude to Dr. Liana Sved for joining us today and sharing her expertise and passion. It has been an incredibly insightful conversation. If you enjoyed today's episode and found value in our discussion, I encourage you to subscribe to Jaw Talk on your favorite podcast platform. We have an exciting lineup of experts and thought leaders who will continue to provide valuable information and practical tips for improving your jaw joint health, as well as best practices for healthcare providers. If you're interested in any of our courses, please visit tmdcollective.online/store. Our website is packed with resources and tools designed to help our healthcare provider community, and also be sure to check out our proprietary JPR technique, a simple therapeutic exercise that can reduce clenching and relieve pain in just 60 seconds. Don't let TMD hold you back any longer. Take control of your health with TMD Collective. While you're at it, be sure to explore our incredible selection of courses and resources, all dedicated to helping you live your best life. Visit us today at tmdcollective.com and start feeling better now.